Cast is now starting. All attendees are in listen-only mode.
Good afternoon, all. I hope I am audible to all of you. Welcome to yet another session of Heartfulness Meditation presented to us by Heartfulness Institute. I'm glad to invite you all to the Mind Matters Week. Just to give you all a quick brief intro about Mind Matters Week. Mind Matters Week is our bit of our way of giving it back to the society from the NHRDN team, wherein we would like to promote mental health and mental well-being, awareness about mental well-being. So in this regard, we've had multiple sessions and multiple activities that we have scheduled starting from October 5th to October 10th. We are in our third day. We've completed 2 days of session, and today, earlier in the day, we had a certification program for our ambassadors who could enable and be the first aiders within their respective organization. We had a participation of about 115 odd ambassadors nominated by the respective organization. We are glad to let you know that we have registrations of about 110 plus organizations across India. And we have sessions even after this. There's a deep dive session at 4:30 after the Heartfulness Meditation session, post which we have a best practice sharing session wherein we have people from TCS, Infosys, and Aditya Birla Group come and share with us their best practices in their respective organization and how it has made a difference within the organization and also within the employees in terms of being more sensitive towards the mental awareness and mental health. Coming back to today's session, I have Dr. Rahul Mehrotra with us, who would be doing the session for us. Just to give you a small sneak view of what we have, this is the calendar. About Rahul, Dr. Rahul is a practicing cardiologist and director of Non-Invasive Cardiology at Max Super Specialty Hospital in New Delhi. Rahul is an avid meditator and heartfulness trainer and has published over 100 papers in national and international journals relating to his discipline of cardiovascular health. He keenly explores the scientific basis of spirituality and often speaks about it in various international forums on topics like how meditative practices contribute to holistic wellness of mind, body, and spirit. I'm delighted to welcome Dr. Rahul to this session. Sir, over to you.
Very good evening, everybody. And I hope you had a wonderful session of Heartfulness day 1, day before yesterday. And today I'm going to take you over to another aspect of Heartfulness meditation. And before that, since I'm a doctor, I'm a cardiologist, as you just learned, keen on exploring the scientific basis of spirituality. So I'll be talking about how to build up joy, develop qualities of resilience, and how to manage stress after all, because joy, happiness is nothing but lack of stress. We are not stressed, we are happy. And joy comes forth from within. So I'll be sharing some scientific insights with you as to how it really is a scientific domain now. All these practices like meditation, spirituality, it's no longer just soft talk. It's hardcore scientific discipline. I'll be sharing some of the evidences with you as we go along in the form of a brief presentation. So if I'm allowed to, I'll just share my screen.
Yes, Dr. Rahul, you can do that now.
Okay. Is my screen visible?
Yes.
Full screen.
You might have to move it to a presentation.
Yeah. So, is it visible now?
Yes.
Yes. Just a minute. I'm needing some IT help.
Sure.
Okay. So let's begin now. Am I audible?
Yes, loud and clear.
Okay. So what is stress after all? And want all the attendees to be willing to answer questions if and why they have any, or we'll take the questions at the end of the presentation. So if I were to ask any of you, what do you think stress is? It is very difficult to define, but we all know when we are stressed. So it is something almost impossible to define, but there have been attempts at defining stress. But we all know the synonyms, and I can hear even children and totally illiterate people, laymen, very poor people talk about mental tension, stress, strain. So these are now commonplace terminologies because stress is all around us, stress is all pervasive. But it is not that simple. We do not absolutely want to get rid of stress. Stress has a positive component to it also. If you know the human function curve, and as HR professionals, you must be aware that it's good to keep the people on the go. So a certain level of stress is useful to make us productive, to make us perform optimally. And this is where we want to function in the green zone. Ideally, we should be slightly more than that in the yellow zone. But the problem is that we do not know when we cross the boundary line. So being positively stressed to becoming stressed to an extent which is detrimental to our well-being is the boundaries are not well defined. So from eustress, which is the positive stress, we jump over to the negative stress or what we identify as the harmful stress or distress. So it is important to understand this concept that not all stress is bad and certain level of positive stress is good to keep us going. So having said that, what we talk about now is going to be stress, which is negative stress. So here is an example, a wonderful example I feel, a roller coaster ride. You can take it as our life. And all of us are on this roller coaster ride. We think we know what is going to happen next, but there is a great amount of uncertainty also. And here is a snapshot of one of the cars, and you can look at the expressions of these four people in this car and this roller coaster ride. All the four are in exactly similar situation, in exactly same scenario, but the responses are varied. From a person thoroughly enjoying on the lower right hand side to certain lower left side almost going to die, while on the upper side he would just keep his eyes closed and rather not face the situation. Here is a combination of excitement and happiness and adventure involved on the upper left side. So same situation, different responses, and this is what is how to manage stress. Stress is not what happens to us, it is basically what and how we respond to the circumstances surrounding us, which determines whether we get stressed or not, or whether we get harmful effects of stress on our body or not. So stress has been scientifically studied a lot, and in order to do that, we've had to define stress, we've had to categorize stress, and this is how it generally is done. We divide it into work stress, domestic stress, financial stress, and life situational stress. And probably we are all passing through all of these or one of these phases at any given point of time. So for example, currently we are all in a similar life situation where we are faced with a life-threatening pandemic to some extent, but most of the stress which other people have is due to unrealistic expectation related to this pandemic, or some of us are passing through financial stress at this point of time, and if we are not, some skirmishes in the household, some happening in the workplace are always source of stress for all of us. So these are four common type of stressors identified, and we all know that they are not existing in isolation. If we are stressed at home, we give stress to all our colleagues at work. If we go back home stressed at work, we carry that stress back home, and all our family members can feel, particularly our spouses can feel the stress that we bring home from our workplace. Life events like sickness, like job loss, like salary cuts happening nowadays, and deaths in near and dear ones, of course, put us into stress temporarily, but if they are prolonged and if they are to a greater extent, they hamper all our other functions of life also. So having understood this basic concepts related to stress, the definition, the types, and how they are interrelated, if I were to ask you, are you stressed? What would be your answer? Probably it would be no. Because this is what happens to our patients. I come across, particularly in this pandemic period, many young patients who come with high blood pressure, and there is no identifiable reason for high blood pressure or lack of sleep or palpitations or increased pulse rate, except that they are stressed. This is what we learn from our textbooks, but when you ask them any reason of stress, no, doc, there is no stress. I am not stressed. I'm not stressed, because we have our own notions related to stress. We all perceive stress in our own way, and we define stress in our own way. And that is the problem with stress. There is no diagnostic test. We cannot pinpoint whether we have stress or not, and whether we are crossing the boundary of eustress into distress or not. Usually it is noted by peers, family members, friends, and sometimes when we are not able to understand what is happening to us, we're not feeling so good about us, we approach a healthcare professional. But this happens very rarely, and generally we are in the denial mode. So a doctor generally is able to pick up like us, and there are no particular diagnostic tests for stress. I cannot do a blood test and tell you whether you are positive or negative for stress. But there are certain subtle signs which we pick up when we see patients, from which we are able to pick up the signs of stress, like increased irritability, restlessness, increasing impatience, unreasonable anger noted by colleagues or family members, sleep, either too much sleeping, avoiding facing situations, or lack of sleep, withdrawal from routine activities, disinterest in day-to-day work, so on and so forth. And sometimes you come across, frankly, with increased blood pressure, increased heart rate, acidity, stomach upset, and then we have to, by exclusion, come to a diagnosis of stress. So just for information, stress is not so benign. It is not so, because it is so common, it is not so mild. Stress is a scientifically known risk factors for so many diseases, and some of these are very important to know, that for example, heart attacks on the right side, strokes, and high blood pressure, these are clearly attributable to stress, where scientifically we know that the impact of stress is as much as, for example, it is related to cigarette smoking or lack of exercise or improper diet. So stress is a known and powerful risk factor for cardiovascular disease. Apart from that, it causes headaches, it causes gastric disturbances, it causes anxiety, depression, headaches, and even known to people who are chronically stressed are known to indulge more and more into substance abuse like alcohol and other substance abuses, which ultimately leads to greater problems. Stress is all around us. Stress is increasing. For example, we have data that more than 350 million people succumb to stress every year, particularly the major form of stress, which is depression, is known to increasingly involve more and more people every year. Prevalence is increases, and even in affluent countries, so-called rich countries, literate countries where education levels are very good, stress is increasing even in those situations, even in those countries. So financially well off, educationally well off, still succumbing to stress. And we have very surprising data from armed forces professionals in the United States and even from our country, which is very, very troublesome, that stress is increasing by the day and it's having this harmful impacts on the overall health and well-being, not only of the people, but as a society, as a corporation, as a country, on all of us. And the worst part is it is underestimated, it is underreported for several reasons, and hence it is undertreated. But what are the reasons for stress? If I were to ask you, there have been a lot of studies, and we all know. Currently, we all will pinpoint this COVID epidemic or the coronavirus as being the major cause of stress, indirectly or directly, for all of us. But there are several other reasons which have promoted the ongoing pandemic of stress, which has been going on for several years now, which is a silent epidemic, we call it, which is engulfing more and more people. And there are several reasons. We don't hold the same job. We have been traveling a lot. We have been shifting places a lot. We have been moving around, not being stable. As human beings, we have been known to, as a social animal, we like to live together. We like to form bonds and stay together for long periods of time. But all that is changing now. There is a breakup of family, breakup of organizational setups, which is increasing more and more. There is increasing ambition, increasing wants, higher salaries, but higher stress coming with that. So these are several reasons which we have come across and which are known to cause stress for all ages. Children are also stressed. Our elderly people are stressed. People who are doing well are stressed because of increasing financial demands. Whatever be your source of income, there are increasing demands by the day. Anyway you look around, there is stressful news all around. Our workplaces are full of stress, targets to be met, other kinds of targets to be met, failing to meet the targets, and somehow we find ourselves too much stressed even after work, which should give us more and more satisfaction. You step out on the roads, this is a typical scene from good times, non-COVID times, from my commute, Gurgaon to Delhi, and this is the kind of traffic you have to encounter. It ends up giving stress to the sanest of persons. Switch on news channels, there's no dearth of stressful situations being bombarded into your homes, making you stressed. And there can be many other reasons, local, regional, general, and for all these reasons, all of us are stressed at some point of time, and this we feel is one of the most important reason for stress nowadays, the mobile phones that we carry along with us. So how to manage stress? First of all is denial. I don't have stress, I don't have to manage. So let's face it, even if we don't have stress, it is good to learn techniques so that we can avoid stress when it comes. So management means prevention as well as appropriate treatment once it comes. The best is to learn to prevent stress, live a lifestyle which we are able to handle stress appropriately and come out performing our functions, performing our duties in spite of a stress that is going to come in our lives. Wherever we may be, howsoever that may be, whatever be our circumstances in life, all of us are likely to face stress at some point of time or the other. So it is better to equip ourselves with its tools. So these are some of the things that we do. Commonly we deny, we blame others, we blame our bosses, we blame our peers, we blame our organizations for giving us stress. Some of us indulge in hobbies to get rid of stress. We go out for expensive vacations trying to beat stress, but we come back into the same stressful scenarios, and that clearly is not a durable solution. Google, of course, is the answer to everything now, including stress. And if I Googled for stress management, this was something I came across on Google. So there are all kinds of tools people are using. Something which is not very common in our country is taking professional help in terms of psychologists and psychiatrists to beat stress, but is quite common in the Western countries. So all these levels of stresses modalities are available to us, but we are looking really for a solution which is durable, which is practical, which can be practiced by one and all at all points of time. Besides, it should be low cost, easily available, accessible, and not just a medication which we can take for some time and get rid of stress. And unfortunately, there is none of this kind of drugs are available. So this is what we are looking for when we look at an ideal solution for stress, if that is what we are looking at. And here is where my presentation comes in. So the best thing is circumstances cannot be changed. If we are waiting for a vaccine for COVID to come up and change the whole scenario for us, I don't think it is going to happen soon. The best we can do in all other kinds of stress, including this one, is to change our approach, change our attitude, change our inner belief systems so that we are able to prevent stress. And this is where we come to our behavior, come to our thought process. And this is where very important role is coming up for meditation. So as I mentioned, being a doctor, this is a common question asked to me, being a man of science, cardiologist at that, how come I am involved in these kind of practices which are so-called mumbo-jumbo practices and left to people who have nothing else to do in olden days, or who have some major problems in their life, they indulge in these kind of things. So I beg to differ, and I'm happy to share some scientific evidences related to meditation, which is the #1 tool currently for stress management worldwide. It is now known that it not only reduces depressive thoughts, people who meditate regularly are found to be joyful, happy, calm, composed, but it also enhances positive emotions even in animals. There have been studies in top institutes, I'm quoting MIT here, where they've shown that mice could be brought out of depressive state by showing happy memories, pictures of happy things which made the mice happy. Similarly, there have been studies, and this is the biggest compilation of study done by an Indian. Around 47 studies were compared with use of drugs for depression and use of meditation for depression, and it showed that meditation was as effective as all the antidepressant drugs we have in the market for reducing depression. Apart from that, meditation does not have any side effects. Of course, some of the systems like heartfulness are even free of cost. I'm going to talk about that. So this comes as a very much win-win situation. So this was another study which was done under the heartfulness banner in the United States in a hospital setting, because hospitals are one of the most stressful places to work at. You're surrounded by disease, death, stressful situations day in and day out. So this was a study done in healthcare professionals, doctors, nurses, healthcare managers in US, and they were given a 12-week course of heartfulness meditation. And it was seen that at the end of 12 weeks, those who meditated reported statistically significant decrease in parameters for burnout, anger, stress, anxiety, cynicism, and there was significant increase in the emotions like joy, calmness, feeling of harmony, tolerance, sleep quality, which is a major fallout of stress nowadays, improved significantly in all these people who practice meditation. So another scientific study done by Heartfulness Institute and published in International Journal of Scientific Research showed that those who meditate regularly with heartfulness system are able to generate gratitude. And this is a very powerful positive emotion which is known to even change the brain structurally. So if you want to cultivate gratitude, you meditate regularly. So this is a very important study that we did at a Max Super Specialty Hospital. I was a participant from Max, and we did it in collaboration with IIT Delhi. And we were able to demonstrate that when you are doing heartfulness meditation, what you did day before yesterday in day 1, and the other practices of heartfulness, which we call rejuvenation on day 2, we were able to demonstrate that during these practices, we measured your ECG continuously during the 30 minutes of meditation and cleaning. There was significant change in the ECG in terms of heart rate variability. It happened. Not only that, the blood pressure also came down significantly when you are undergoing these practices of heartfulness meditation. So these were remarkable results demonstrated in meditators in our hospital, and the study was published in the premier journal of our country, the Indian Heart Journal. And we also had subjective feedback from the practitioners who participated in this study at the end of 30 minutes of meditation, and we asked them how happy they felt, how peaceful they felt, how enjoyable the practice of meditation was, and it was invariably above the score of 9. You can see how demanding, very less demanding, less than 3 was the general score, both the practices of cleaning as well as meditation. So remarkable results in terms of objective parameters, heart rate variability, blood pressure, as well as subjective parameters of feeling of well-being, happiness, feeling of peacefulness. So this study was very popular and it was picked up by the media also, and this study got widespread coverage all across the country in terms of uh, showing that for the first time, two big institutes came together, IIT and Max Hospitals, and we were able to demonstrate the effectiveness of meditation in terms of measurable parameters of health, not only psychological health, but cardiovascular health also in terms of heart rate and blood pressure. This was covered by big media houses, how heartfulness meditation was able to scientifically prove the efficacy immediately. As you were practicing meditation, your neurology, your cardiological parameters were changing and you were able to feel happy. And we presented an abstract of based on this study related to happiness and heartfulness meditation parameters. And this abstract was presented at the world's first symposium, which was held at All India Institute Rishikesh last year in March. So this is another evidence that how worldwide now this is being looked at, meditation and spirituality is being looked at as a very much scientific discipline. So this symposium was dedicated to meditation and cardiovascular health, and our abstract on heartfulness meditation won us the first prize for overall best research on heartfulness meditation practices from all the papers across the world. This was a clear demonstration on its remarkable effect on health immediately after the session of meditation. Another scientific proof, this article I wrote around 4 years ago, the different scientific evidences that we have related to different practices of yoga, meditation, and what is the effect on heart. So this was a review article published in 2016, and this year it got 2,000 hits on the research portal. So there is no wonder worldwide that people are interested more and more in exploring the scientific basis of spirituality, and these are topics which are being explored in great details in one of the top places, top research institutes of the world for their positive impact on health. These are other evidences which I am very briefly going to talk about and show. Science of Meditation on the cover of Time magazine more than 15 years ago. Similarly, we have researches clearly demonstrating the effect of meditation within 15-20 minutes on the brain and the brain waves. New interesting findings coming up related to how the impact of meditation happens even on the DNA level, how our thought processes are able to alter our nerve connections, our neurology is being impacted, how we can control our emotions like anger, cynicism, positive emotions like joy, gratitude can be developed by meditation, how the brainwave patterns that we study by EEG is altered by meditation, and how it can be used for improved learning for children in schools and institutions and improved focus of professionals. For example, in corporate setups, this is being utilized now for giving their employees regular meditation sessions so that their focus, attention span improves and overall results in better performances at their workplace. Similarly, in healthcare scenarios, these are American Heart Association statements which now endorses the use of meditation as a tool for bringing down blood pressure and for overall reduction in cardiovascular disease risk. So these are clear recommendations from American Heart Association now. So there was a time 10 years ago when I used to hesitate telling people that I actually meditate because this was something to be laughed at. But now this is the American Heart Association giving statements, and this is a snapshot from the Mayo Clinic, a hospital which shows that meditation is being promoted in this hospital as a stress reduction tool, the number one tool that this hospital promotes. If you visit the website of this hospital, this is how they define meditation, and they offer meditation within the hospital premises for those people who want to take up meditation sessions in the hospital. So, ladies and gentlemen, this is the crux of the scientific evidence I wanted to put across to you. Because meditation as a tool for reducing stress is very much accessible to everybody, can be practiced anywhere at any point of time. Systems like Heartfulness are freely available, no fee charged, no other inputs involved, and it's extremely simple to practice. So I propose it for all of us to experience Heartfulness practices and take the advantage of this. Another evidence I have is, if you can guess the number one bestsellers in the last 2 years on Amazon, these have not been books related to cricket, not been books related to finance, not by Raghuram Rajan or Sachin Tendulkar. These have been books related to meditation. The Heartfulness Way topped the chart immediately after release in the first 6 months of 2018. And the next book in the series, Designing Destiny, is a scientific compilation of how meditation practices impact, scientifically explained how it impacts our overall well-being and health. This again continued to top the chart as per most of the book reviews and surveys. So this clearly shows that this is what people are interested in reading, and how we can better our lives is what we are all interested in. So this clearly is the next big wave all around workplaces. These are snapshots from places where different workshops related to heartfulness have been happening. In pre-lockdown days, this was a common scenario. We used to go around in corporates doing these kind of workshops, but nowadays it is all virtually. But the number of workshops having increased significantly even in these times, virtually also, and the efficacy has remained remarkably well as demonstrated by the surveys that we do. So these are pictures from heartfulness workshops from across the globe done in different corporate settings. These are people going to war, sitting for meditation just before they are being posted off war, different work scenarios. More and more corporates, public sector as well as private sector are part of heartfulness workshop practices. And this is how we can connect to us. We'll share more information in the days to come. We can connect to us and practice these sessions very easily wherever you are. You get involved at your corporate level also. And after this brief overview of scientific evidences related to meditation, how not only they help reduce stress, but impact other components of health also, overall sense of well-being also is being taken care of. I'm available to discuss any other aspects you have, any questions that you may have after the session. So prior to that, I think now it's time for us to experience actually heartfulness meditation. If you are ready, I think I'll hand over to Guru Prasad, and we'll have an experiential session of meditation now. If you are ready, you can sit wherever you are in any comfortable position with your back straight and upright. Gently close your eyes, and I'll be giving you certain commands related to meditation, and just follow those commands. And after that, when I ask you to open your eyes, very gently open your eyes and make a note of the condition. So it will be a good idea to just make a note of your current state of mind. Just observe yourself, how you're feeling right now. Make a mental note, and let's make it a scientific exercise. Let's see before and after what happens with this unique heartfulness meditation session that we are going to experience. So just before we begin meditation, I am going to give you a very brief glimpse of rejuvenation, which is another
Dear participants, please bear with us for a moment while we reconnect with Dr. Mehrotra.
Hi all, we are just connected with Dr. Rahul. He'll be online in a minute. Thank you for your patience.
Just observe your condition. Once you have a grip on the condition, gently open your eyes. If you have any questions now, we'll be happy to take them.
We have a couple of them, sir.
Yes, please.
There's one question from Rupesh Chaudhary. He says, "So, what do you mean by cleaning when compared to meditation?"
Yes, so as I introduced cleaning, the other word is like rejuvenation. This is a unique practice that you have in heartfulness. And this is what we do at the end of the day, in the evening, when we sit down and mentally remove actively all the impressions formed as well as subconsciously during our interactions that happen during the day. So this practice is done once for 15-20 minutes in the evening when we have completed our work. This is a very fundamental and very unique component of heartfulness, in the sense that this is the root cause of what we later manifests as stress. The impressions that we keep forming in our interactions with people, when we meet people, when we look at so many things, our mind is compiling those impressions, and based on those impressions we form judgments, and which determines our responses later on to different situations. If we are able to remove these impressions, and it gives us a clear slate, you can say, or a clear mind, you can say, free of any kind of impressions, so that when we respond to a given situation, we are responding as per need, as per requirement, and not based on some preconceived notions and impressions, which all of us do, based on what is deposited in our subconscious memory. So that way it is a very useful practice. Meditation we do once in the morning, cleaning we do once in the evening when the day's work is over, and it complements meditation in a way. You can have more details once you connect to us and you visit the Heartfulness website, heartfulness.org. You'll be able to read more about these practices and take it forward. Briefly, this is it. What we tasted was a small sample. Actually, we do it for 15-20 minutes. Gives you immense lightness and sense of rejuvenation. Actually is felt.
So the next one is, there are a couple of them who are requesting for your slide deck, because it talks about your links to your articles. So there, one question is, can we get the slide deck? One more question similar to that is, can we please also get links to the article so that we can read them through?
Sure. So I'll do those. I can share them with you.
Sure, sir. We will share it
the
with
link to the study. And if you go to the PubMed or ResearchGate or Google, the studies, Heartfulness Meditation studies, you will find all those studies published in index journals. But in any case, I'll share them also.
So my next question is, I tend to sleep, and I think I did snore as well during the meditation. How do I rectify this?
So did you sleep or snore today also? If I can identify the person, no, it's okay. Since this is another proof of the efficacy of the practice of meditation, it gives us so much of relaxation that even in the middle of the day, we can lapse into sleep. So this is, I think, a tribute to the efficacy of the system, one. But having said that, I agree with you that it is much more enjoyable, it is much more pleasant if we are awake and alert during the entire session. And if we are able to experience what transpires during these times of meditation when we are sitting with our eyes closed, what is happening inside us. So it is best to remain alert, keep your back straight. If you feel that you have gone to sleep, oftentimes it happens in heartfulness that actually it is not sleep. What happens is that we go in a brainwave state which we call the delta state. I showed a slide wherein I discussed different brain waves very briefly. So deep sleep, when our mind goes into deep sleep, it is a relaxed, calm waveform that is recorded in the brain, which is the delta waveform. And similarly, when you go into states of meditation, a similar waveform is recorded because the brain is in a similar relaxed condition as if it is in deep sleep state. So meditative state produces the condition in the brain which is similar to deep sleep state, although it is not sleep. So we should differentiate sleep from deep meditation. Deep meditation is something desirable, while deep sleep in the daytime we don't want, obviously. Otherwise, meditation sessions will not happen at workplaces. And the best test to know whether you were sleeping or it was deep meditation is to note your condition after you come out from meditation. Because after a meditation session, you will generally feel light, you will feel refreshed, you will feel happy, calm. While if you are getting up from a session of sleep, your head will be groggy, you will not be alert, and you will not be feeling as good as one feels after the session of meditation. So this is the test of the two. Generally, what happens is that you go into deep relaxation, and it is best to remain alert to note what is happening during meditation.
So there is one question from Nitin. Would you be able to simply define heartfulness in a sentence for easier understanding?
Heartfulness system is a way of life in which we lead life with the help of heart.
Thank you, sir. Thank you.
That is the best way of living a life.
Thank you for that, sir. So I do not see any other questions. And I would request Nishaji to please post the survey link for the session, for this session. Thank you very much, sir. Thank you for your time and sharing your wisdom and helping us with this heartfulness session. We had a total of about 170 participants today in the session. Thank you so much for everybody for taking time out during the day and participating in the session. And special thanks to Dr. Rahul as well for the session, sir. Thank you so much.
Thank you.
We are close. Thank you.